Hello, my name is Dennis. I'm a nurse practitioner student at MSU. Today I'm going to demonstrate the abdominal examination. In beginning any examination, you always want to introduce yourself to your patient. I'm Mackenzie. My name is Dennis. I'm a nurse practitioner student at MSU. How are you today?
Good.
Good. Is temperature okay in the room?
Mm-hmm.
Okay, perfect. Other thing you want to do is to wash your hands. You want to do that before completing any examination. Also, at the beginning of any examination, you want to do a general survey where you're just looking at the patient. You're looking at their general demeanor, kind of their facial expressions. You're looking at their nutritional status, their stature, their build, just whether how they're interacting with you, and most important, you want to evaluate whether they're in any kind of acute distress. All that looks good with Mackenzie here, so we'll begin the abdominal examination. Mackenzie, I'm going to have you laid back on our bed, which is our table here today. And in performing the abdominal examination, you're going to begin with inspection, as with any examination, but in abdominal examination, generally you're going to, after inspection, you're going to auscultate and listen to the abdominal contents before you percuss or palpate. Mackenzie, I'm just going to pull your shirt up a little bit here, okay? Okay. And in inspection, I'm looking at the abdomen. I'm looking at the contour. I'm looking at the symmetry. I'm looking if there's any hair distribution. I'm looking at the skin. Just notice a couple of scratches, probably from the cat. I'm not seeing any kind of movements, any pulsations or peristaltic movements. And once I've completed the inspection, I can proceed to auscultation. In auscultation, I'm going to begin at the right lower quadrant and listen in all four quadrants. We kind of divide the abdomen into four quadrants. Listening to the lower quadrant. Is it a little cold? Sorry. And I'm just listening for vowel sounds. And I'll take long enough to get a good sense of whether they're hypoactive, normoactive, or hyperactive. Listening in all four quadrants. Good. And Mackenzie has normal active vowel sounds. Also, while we're auscultating, I can listen to the underlying vasculature. I can listen to the aorta, which kind of runs down the middle just a little bit right of center. I can listen to the renal veins coming off of the aorta. And the iliac, which is down a little further. And I'm listening to the underlying vasculature. I'm listening for any bruits or venous hums. And I'm not hearing any of that with Mackenzie. Once we've completed auscultation, then we can begin with percussion. Now with Mackenzie, with percussion, what I'm going to be doing is just kind of tapping on your belly. And just as with auscultation, I'm going to begin in the right lower quadrant, tapping in several places in each quadrant. And what I'm doing is just doing a quick strike. And this I'm listening to the underlying sound. It should sound rather tympanic, kind of like a drum, because there's a lot of oxygen and gas underneath. Unless you're over organs. And when we're looking for organs, I'm going to try to percuss to get the idea of where the borders of the liver are. What I'm going to do here is just go up a little bit more here. I'm going to start low. There. Okay, so she's about 5 centimeters. I get for the borders of the liver. When you're percussing coming from the top, you always want to go to the intercostal spaces. You can also do the same for the spleen. What you do for the spleen is come to the 9th or 10th intercostal space, mid-axillary line. Take a deep breath for me. Okay, let it out. And what I'm listening for there is I tap and it was kind of tympanic, and I have a deep breath, and I tap and it was still tympanic. If there's any splenic enlargement, then that would become more of a dull sound as the enlarged spleen is kind of pushed up by the diaphragm coming down, and it would suggest an enlarged spleen if you had that kind of finding. Okay, after percussion, then we're going to begin with light palpation. With light palpation, I'm going to begin again with the right lower quadrant. And Mackenzie, I'm just going to be kind of lightly palpating your abdomen. If there's any tenderness, let me know, okay? And what I'm doing here is just 2 or 3 centimeters deep, just kind of checking for any bulges, any masses, any tenderness, anything like that. Okay. And I'm not finding any bulges, masses, pulsations, or tenderness on Mackenzie as I lightly palpate. If I do find something that is tender, then when I do deep palpation, that's the last thing that I'm going to approach that area. In this case, I'm just going to begin in the right lower quadrant again, going a little deeper this time. Just feeling for that. Just kind of relax as much as you can. That's nice, easy breaths. Sometimes you can feel a little underlying bowel. In Mackenzie's case, her abdomen is nice and soft. It's non-tender. No guarding is noted. These are all normal findings. So we've inspected, we've auscultated, we've percussed, and we've done some palpation. Now we can also palpate and attempt to feel some of the underlying organs. And the liver is always over here on the right. You can sometimes palpate. I'm going to be deeply pushing here. Can you take a deep breath for me? And let it out. Again. Okay. Mackenzie cannot palpate. Sometimes you can feel the liver edge just kind of come up to and kind of palpate your finger as they take a deep breath, and it kind of pushes it against you. The same thing with a spleen. With the spleen, the spleen tends to enlarge, and if it enlarges, it kind of enlarges in this direction. So you kind of want to begin here and kind of push down. I'm going to have you take a deep breath. Okay, and then let it out. And I'm going to move up. Another nice deep breath. Good. Another nice deep breath. And get to the costal margin. Another nice deep breath. Okay, good. And what I'm feeling for there is just as with the liver, you're feeling for anything kind of palpating against your fingertips. And a normal finding is to not be able to palpate the spleen. In this case, I cannot. So no evidence of enlarged spleen, which is good news. And then after that, now for the purpose of this video, I'm not going to undress Mackenzie, but you would feel along the inguinal lymph nodes, kind of along here, feeling for any enlargement or tenderness. You can also can auscultate here for the femoral artery. And I'm not hearing any bruise um, with the femoral artery either. And you can also palpate the femoral artery at this time if the patient is undressed completely. And that pretty much completes the abdominal exam. Thank you very much. Thank you, Mackenzie. You can get dressed.